Drivers, hey, welcome all across North America. Dr. Fahmi Farah is on with us now, one of North America's leading cardiologists, one of the recognizable names out there today. And Dr. Farah, it's always great to have you on the radio. I want to welcome you back. How are you?
I'm great. It's always great to be on your show. Thank you for having me back.
Absolutely. Absolutely. Thanks for joining us. You've got a lot of things that you do, not only being one of the most recognizable names in cardiology in North America, but you've got a great hospital that is in the Dallas-Fort Worth area, Bentley Heart. Tell folks about that and all the things you do. I want to welcome you back.
Well, I'm an invasive cardiologist. I'm also the CEO and founder of Bentley Heart Medical Center, and also a director of Global Health Lines Foundation. Okay,
very good. Thank you very much for jumping into the conversation. Interesting what we've got going on with the heat. I was doing the weather a short while ago and talking about the fact that basically everything east of Interstate 35 coming up over the next couple of days, I think Minneapolis all the way down to Laredo, is going to be under a heat wave. I mean, we're talking about maybe 40 million people under heat warnings, heat advisories, and things like that. And I was thinking, okay, what is this doing to the heart? When you get excessive heat, like what many of us are experiencing right now, can there be numerous effects, say, on the heart disease situation? Does it make it worse? How does the heat affect somebody with a heart condition?
It certainly can make things worse, especially somebody who has pre-existing cardiac condition. Excessive weather of any kind can exacerbate that condition and make things far worse for people who have blockages, for example. In excessive heat, they can go into heat stroke, and that can precipitate a heart attack. For people who have congestive heart failure, excessive heat can dehydrate issues with breathing and things like that. Along with people who have rhythm problems, excessive heat can cause dehydration and can cause heart rate to go up. People who have things like atrial fibrillation, dehydration is not good for that condition. And so, yes, on a number of cardiac conditions, those can get worse with heat.
All right, doctor, you mentioned like arrhythmia, for just an irregular heartbeat, or is there a lot more to that?
A little bit more to that, but yes, in general, arrhythmia, especially atrial fibrillation, it means that the heart is not beating in a regular pattern. It's irregular, and there's a lot more consequences that come with that pattern, especially with atrial fibrillation. So when people are in atrial fibrillation, their heart, the top chamber is not beating properly. It's not squeezing. It's kind of quivering, so to speak. And when that happens, stay still, and it can form blood clots inside that part of the heart, and blood clot can go into the brain and cause a massive stroke. That's one of the most feared consequences of atrial fibrillation.
Oh my God! And you think about with the heat and maybe lung disorders that many folks have, the heat now in place many parts of the U.S., and it's almost like you get the ozone effect, where it seems like a hazy day, and that creates a lot of issues, doesn't it? Correct, for people that maybe are on maybe COPD medication. Does that exacerbate that situation for them?
It certainly can. It can, across the board, it can make those things far worse, especially in acutely, very high temperatures with long exposure.
Okay, very good. So that's why is it recommended that people that have got, say, lung disorders, maybe to try to stay indoors as much as possible? I know you got to get out and about, but if you've got something going on with breathing, try to stay in as much as you can?
That's correct. Avoid that long exposure as much as you can.
Okay, and the other side of that, many of the people that are listening, doctor, that they are in and out of a truck maybe 5, 6, 7, 8, 10 times a day, that they're having to make deliveries. Any recommendations as far as maybe trying to mitigate some of the effects of, say, and the heat? Maybe try to take frequent breaks. Any recommendation on somebody that's actually working outside of the heat?
Yes, for those folks who are working outside in this type of heat, it could get dangerous for them. So I definitely recommend them taking frequent breaks throughout the day and staying hydrated. Hydration is for them.
Okay, and if somebody's on like a rescue medication, say, doctor, for I don't know, I'm going to say like maybe Primaxine, I know that's over the counter, maybe some are prescribed prescription medication. Do the medications help maybe somebody overcome quickly? And I would imagine you can't use those too frequently, or can you? The rescue meds.
You're talking about which rescue meds? Sorry.
Yeah, the rescue meds, like for things like maybe get over the counter, or maybe the doctor's prescribed something for the lung disorders. That could maybe bring a short-term relief, but does that also maybe raise the chance for the heart rate to go up if it's used on a much more frequent basis? Does that cause issues?
Yeah, it can. So, in people who have lung conditions like asthma or COPD, they can be on things like albuterol inhalers. Inhalers, they can raise the heart rate, especially albuterol. It's known to cause increased heart rate. So if people are having more exacerbation as a result of high heat, which can happen, and as a result they're needing to use those inhalers more frequently, see a high heart rate and rhythm problems. So I would talk to to get help with that.
Okay, very good, doctor. We got to do the commercial thing. And we'll come back on the other side and talk the heat. Can the heat cause kidney disease problems to get worse? Does that raise maybe heart rate conditions, diabetes? These are some of the pre-existing conditions out there. Can these conditions lead to things like cardiac distress? We'll get into all of that. Guys and ladies, you are opening up that left door 7, 8, 9, 10 times a day. The best you can, but sometimes it's not easy to do that based on what you got to do. We're talking about the lifeblood of the human body. That is the human heart. And Dr. Fahmi Farah is on board. We're going to break back in a minute. SiriusXM 146. Dr. Fahmi Farah is on the phone line with us, and we're talking about your ticker, the hearts. How's that thing doing out there, ladies and gentlemen? That is the lifeblood of everything. And that's why you got to make sure that thing is running right. And that's why Dr. Fahmi Farah is on to help you navigate through. Not here to diagnose you over the phone, obviously, but to give you that input, feedback on. So, again, thank you, drivers, for putting us on the show. And Dr. Farah, again, thank you very much for offering the insight. And you got things like kidney disease, other stuff going on. Like you mentioned, just to reiterate, that really can exacerbate a pre-existing condition with the heat, right?
It most certainly can for so many different reasons. If somebody's exposed in heat for long enough, of course, they can go to things like dehydration, heat stroke, and with heat stroke, there could be internal organ damage. Kidneys are definitely one of them. They're very sensitive to dehydration, especially for those who have a pre-existing kidney condition. They would be even more predisposed to that.
I mean, is it simply just a matter of you being thirsty, or can you be so thirsty you don't even know you're thirsty?
It could be it could be a little bit of both. By the time you're thirsty, you're already dehydrated. So you should really stay hydrated before you get thirsty. But some of the ways to know would be, your urine color is a great marker. That's a good marker to know that, hey, you're dehydrated, need to drink more water. Also, your skin would be kind of dry, clammy. Some of the symptoms of could be dizziness. A lot of times people feel dizzy. Heart rate could be elevated. When you're dehydrated, blood pressure can be low.
Doctor, when somebody is thinking about, okay, they're thirsty, they want to get something to drink, they go to a convenience store and they get like maybe some Gatorade or like a sports energy drink. Is that a good way to get out of that dehydrated cycle, or simply just old-fashioned water is the way to go? How do you see that, like mixed drinks, sports drinks?
Well, for hydration purposes, the two best things would be just simple water and also some kind of an electrolyte drink, like either Gatorade or Pedialyte, something that has electrolyte for those who are staying outdoors for long periods of time and sweating. For that replenishment with a little bit of electrolyte in their water is a great idea.
Okay, very good. So the electrolyte, if that goes down, if you're losing electrolytes, that could impact your heart as well.
It could, yes. Your electrolytes are just so important, and imbalance in that can cause, along with dehydration, rhythm problems in your heart, and especially for those who have something that's already existing, like atrial fibrillation or something, they don't tolerate electrolyte abnormalities very well.
All right. You know what's interesting to me, Doctor, and you've seen it, I've seen it, probably everybody else has as well, that you get the exercise folks that are out in the middle of the day, 100-degree heat, and they're jogging away right in the middle of that heat, and there they go. If you can do that, great. But I'm thinking, Doctor, that if it's not done correctly, even though somebody's an able-bodied individual, can exercising in the heat maybe take a toll on the body or on the heart overall? You see a lot of that.
It can, and it could get pretty dangerous pretty quickly, especially in such high heat zones like Texas that we worry about. Is called rhabdomyolysis. That can happen in people who are exercising excessively in the heat outdoors. It's basically breakdown of your muscle, and it can affect everything, particularly the kidney. People can actually go into kidney failure with that. So I definitely advise people to avoid doing that.
Okay, and we've got a frequent caller that dials in, loves to play golf. Just a golfing nut, which is great, but I'm thinking maybe he's getting out in the middle of the day, swinging those golf clubs around when he gets maybe a break under the federal regulations out there. If you're going to be doing that, maybe less strenuous exercise, not the full-blown attack mode exercise that a lot of folks do. Maybe a little bit milder, softer form of exercise.
I agree. It would have to be a little bit softer form of exercise, and not discouraging anybody from exercising by any means. In fact, I think people should continue exercising during all seasons. Just need to be more indoors and in a safe way.
You know, one of the great ways to exercise is to do ballroom dancing. See how all of that led into that fact? Because drivers, in case you don't know, Dr. Fahmi Farah is an award-winning ballroom dancer. And what a lot of fun. She's won awards for that kind of activity, and that is something I think is so critical. Obviously, it's going to get her heart rate up, and good exercise, moving all of the various parts of the muscles of the body out there. Doctor, thank you. Great. As always, Dr. Fahmi Farah on, and let's get your website out there, good doctor. Where can folks find you? Where can they go?
Thank you. You can find me at www.drfahmifarah.com. You can also find me on social media at Fahmi J. Farah on Instagram and Twitter.
Okay, very good. Doctor, thank you very much for jumping in. That is Dr. Fahmi Farah.